Good morning, everybody. This is David Farnes for CATAnetTV. Um, Sorry for the slightly delayed start. We had some connection issues again. So this is CATAnetTV, the mobile health channel, and we're very pleased today to be joined by Catherine Atkinson, who is research coordinator at the Ottawa Hospital Research Institute in the Clinical Epidemiology program. Welcome, Catherine.
Thank you.
And so let me give you a little bit of background about Catherine and what we're going to discuss today. So Catherine is interested in how new technologies can be applied to address challenges in public health. Her recent work has been focused on the development, evaluation, and enhancement of a pan-Canadian immunization app called ImmunizeCA, and that's what we're going to talk about today. She's been working with Dr. Wilson at the Ottawa Hospital, and together they are examining the effects of mobile apps on users' attitudes towards vaccination, the effects of media and public health promotions on app uptake, which is interesting as well, and opportunities mobile technology presents for improving immunization practice in general. So that's all the stuff that we're interested in here at CATA. So Catherine, thank you again for joining us. And maybe you could just start by informing the audience as to why it is you developed ImmunizeCA. What's the problem you're trying to address with it?
Great. Well, thank you very much for having me. This is a really fun way to be able to talk about our work, and it's great to see all of the development in mobile health in Canada, so thank you to CATA. This all started quite a while ago, back in 2012. Dr. Wilson was at the neighborhood park with his son, and a fellow park bum approached him and said, "What is the deal with these yellow cards? Like, you're a physician. I can do everything on my phone. I can do banking. I can make purchases. I can connect with everyone. Why am I supposed to carry all of my immunization records on paper? Can't you put this on the phone?" He thought, actually it's a very good idea. So we developed the first prototype of this app specifically for Ontario. It was called ImmunizeON, or ImmunizeON, and we released it in November of 2012 just for iOS platforms. And it was very simple. It just had the pediatric schedule in it, but it basically took that yellow card and put it on your phone. We went ahead and released it with not a lot of planning as to where this would go, and there was fantastic uptake. So Dr. Wilson was on the front page of the Citizen. We had moms emailing us saying, "This is so great, we really appreciate it. Could you add this? We would love to see this. This feature doesn't work so well, could you adapt it?" That led to us partnering with the Canadian Public Health Association and Immunize Canada, which is one of their coalitions, and through funding for the federal government, we expanded the functionality of ImmunizeON. So in March 2014, we released ImmunizeCA, which had all provincial and territorial schedules. So we went from having one pediatric schedule to 13 pediatric schedules, plus 13 adult schedules. We have every immunization fact sheet. We got an amazing reference group together, and we plain languaged all of the information, added in some frequently asked questions about immunization. We have outbreak alerts. So it's all started from a mom saying, the way that this is working now is not great for her, and could we make it a little bit easier? And all of the iterations we've been doing are really based on our users' feedback.
I love the way this started. This is one of the examples I like to use. I like to talk about how I can go use my smartphone and go onto my mobile app for banking, and I can pay bills, I can figure out the balance of all my accounts, I can buy stocks, I can do all of this stuff. And yet, if I use the example, if I step on a rusty nail and I go into the clinic, I can't tell you when I last had my tetanus shot. So I think this, and I have 3 kids, so the yellow card thing and information coming home from Public Health Ottawa, from the school, and my daughter's backpack, all this stuff just drives me crazy. So I love this solution. It's fantastic.
And that was really our aim, was to empower individuals to take control of their own health information. So if you show up in Emerge unexpected, you do know when your last tetanus shot is, and before you're entering the the appointment with your child at your pediatrician, you can take a look and have an idea of what's about to occur and be informed if you want to engage in a dialogue with your physician, and just to be able to have that information on hand. And one of the things that we're very grateful is our partnership with the Canadian Public Health Association. So they've done an amazing job of curating all of the content, both through their members and through an expert reference group. So we are confident that the information that's reaching our users is reliable, is accurate, is up to date, and is accessible to them. So we have everything in both official languages. We have, through support from the federal government, everything is updated every quarter. So you know that if you're going into the ImmunizeCA app, you know what you're finding is the most reliable and up-to-date information from a trusted source.
And you push out alerts as well, or travel advisories on the app too, I believe, right?
We do have a section for travel vaccinations. So you can go in, and again, our reference group has been amazing. For every vaccine, we have who should get this vaccine, what does it protect against, and just some quick facts. So if you are traveling, do you need yellow fever? Where are you going? How does this vaccine work? Should you get it? And all of that's to a grade 7-8 reading level. So it's very quick. It's very easy to find out if that vaccine's right for you. And how the app works is you put in your demographic information, so you can create profiles, and you can create profiles for your whole family in one phone. And it uses your date of birth and your province of residence to create a customized schedule for you. So
Awesome.
It takes kind of that guesswork out, and you look at the schedule now, and it's this graph, and there's dots in the middle of columns, and so this is a really easy way to understand your specific custom immunization schedule.
So let's chat a little bit about the uptake. What's the response been?
The response has been fantastic. Like I said, we first launched Immunize On in 2012, and we got about 6,600 users in Ontario alone. And we didn't do very much uptake, or very much promotion, I mean. So we had that first article in the Ottawa Citizen, which we found through Google Analytics really spiked our downloads. But other than that, it was all word of mouth and physician recommendation. So one of the things as a researcher that we were very curious about when we were developing Immunize Canada and about to release it was, how can we tell people about the app, and what will actually work to get people to download the app? Because in mobile technology, it's a bit funny, and it's something that we're trying to elucidate through our research program, is even if someone finds out about the app, only some of those people will download the app. Mm-hmm. And those who download the app, there's only some of them who are actually going to use it. So how can you best tailor your promotional strategies to actually not only allow people to know about it, but really for them to download it and use it? So we released in March 2014, and we've got about 65,000 users across Canada. We've got over 1 million page views. We're about 1.1 million page views. So we know that when people are going into the app, we've got over 200,000 sessions. So when they're going in, they are using it. We're averaging over 5 pages a session. So the response has been great, but what's been really fun as a researcher is we're able to look at the effect of various promotional strategies. So specifically, we've looked at Apple promoted our app in the Best New App Store the week during the launch. Mm-hmm. So that really drove uptake on the iOS platform in March. We saw, and I've got a big poster in my office with these results, we saw about 85% uptake on iOS right off the bat, and less so on Android and BlackBerry platforms. Over time, they've started to even out, but in July, the federal government, so the Public Health Agency of Canada, included a little card about the app in the Universal Child Benefit checks, and we saw a big spike in downloads, and they were more evenly distributed between iOS and Android platforms. So it appears that different promotional strategies will drive uptake across platforms differently.
Catherine, John Reed here. While you're a researcher, I'd also suggest you're an entrepreneur, so I do have a question. We're trying to encourage more innovation and entrepreneurship and commercial success in Canada. If there's one thing that you could change to accelerate that whole process, what would it be? I mean, you've gone through the experience.
It has been very challenging to pair not only healthcare with innovation and entrepreneurship, but I think specifically public health. Immunization is a special space, so you do have to be very aware of, kind of the principles and the culture within that space. If there's one thing I could change, I would think I would encourage others to pursue this, to change the culture around innovation. I think the more we see it, the more people will be comfortable with it. And the idea of commercialization doesn't have to be the traditional sense. So everyone keeps asking us, when are you going to start charging for the app? And we say absolutely never. That's, this will always be a free service to individuals. And people say, well, how do you make money then? Or, will you include ads in the app? And again, that's something we say absolutely never, because that's not the right approach perhaps for a public health application that's user facing. So we need to think, again, in an innovative way about revenue streams and a different way to approach the idea of entrepreneurship and commercialization in this space.
Well, I think that's a very good answer. It is, I put you on the spot. We didn't even tell you we were going to ask that question, but culture is so powerful, and everything flows from having the right culture, the right talent, and the right rules to allow innovation. So, thank you for that insight.
And Catherine, I just wanted to follow up on the uptake and the promotional activities. Are you aware, like, are pediatricians recommending or suggesting to any of their families to download this app and keep track of information?
Yeah, so physician recommendation, I think, is going to be one of the biggest predictors. And our partners, again, at CPHA have been fantastic. They've been doing a lot of the legwork in getting out posters to all of their members, so Canadian Pediatric Society and all of the family docs. So we've got these great big posters that are going up in offices. And then we have the Ottawa Hospital and Trillium in Toronto, the two biggest birthing centers in Ontario, are recommending the app in the go-home packages after birth. We think likely that the best time to get moms onto this is when they have a new child, because you have that block of immunizations at 2, 4, and 6 months. There's already so much on your mind. You have so much new responsibility. If there's the process of immunization and understanding the process of immunization easier, that's likely a great time to help out. So we've really been focusing on the birthing centers, and we have the Ottawa Hospital and Trillium on board with that. So that will really help. But I think at your physician, again, it's a trusted source. It's someone who, if they're going to recommend it and they know that the information is reliable, then you're more comfortable to adopt the app and trust that the information you're getting from there is reliable. I think, again, I keep saying immunization is a special space. With vaccine hesitancy and with the prevalence of misinformation on the internet, anti-vaccinationists have been actually rather innovative in the past 10 years to adopt new platforms of disseminating information. So when you go into Google and you Google vaccines, 40% or more of the information that's going to pop up is going to be contrary to medical information, and it's going to be anti-vaccine. So if we're able to provide a mechanism to bypass the internet to get the right information before you're searching, then I think it's a way to help kind of regain lost ground in the innovative space.
Yeah, I agree with you, Catherine. And it's one of the issues that we're struggling with at CATA as we try to figure out how we can drive adoption here in Canada. There are likely 100,000 apps out there in the app stores now, ranging from kind of health and fitness apps to ones that are much closer to providing medical advice and so forth. And you know, your app has got you're a great solution, right? You've got the Ottawa Hospital behind you. You've got an expert panel. You review information, or the expert panel reviews information quarterly. You make updates. You've got other strong partners, other agencies involved, and so you pass a lot of gates in terms of you know, an ordinary patient or even a healthcare professional saying, hey, this is a good solution. But do you think there's some work that we need to do in Canada to help distinguish, and this is an oversimplification, distinguish between good apps from bad apps, to be able to identify the truly good ones that are performing to clinical best practices?
I think as a concept, that's an amazing idea, and I think for the general public, it would be very helpful for them to have a quick and easy way to distinguish something that is accurate and something that is endorsed and is up to date with current, as you say, best practices. But I think there's a lot of logistical challenges in that from a regulatory point of view. If you look at the huge expansion of this industry and the number of apps in the store even last year versus this year, I don't envy anyone trying to take that on, because the review process would be just logistically challenging. Mm-hmm. I think there again, and I talk a lot about difference in platforms, obviously the philosophy of different operating systems is different, and we started working with Apple right away after Immunize On. They called us actually when we released it and went, we've been waiting for someone to do this. We can't believe that no one has done this. We'd love to kind of help you. And they helped with the initial redesign of ImmunizeCA, and again, I said they promoted our app in the Best New App section. They have a fairly, I don't know if you guys have submitted apps to iTunes before, but there's a review process. Mm-hmm. It takes about a week. They go through the app. They make sure first that it's functioning correctly, so they're not going to load it up on a phone and have it crash. But also they do have some predatory information review. And I think that's helpful because they have a lot of bandwidth to do it. I know Android has taken the opposite approach and has said, you know, this is an open system and we're not going to be reviewing these types of things. So I think there's a challenge across platforms in that regard. But it's nice to see that there's already something there. I think having endorsement or having partners on your app, like, you know, with OHRI and with CPHA, that's a symbol that people recognize. So if you are going to release an app in the health sphere, should you partner with a recognizable organization that people go, oh, you know, Sick Kids in Toronto, Sunnybrook, something, they go, okay, I know that someone's looked at this. Mm, or maybe, you know, if CATA had a stamp of approval that was recognizable to people.
That's certainly something we're thinking about, is some sort of scheme for Canada. And but I agree with you. It's a big task. So many apps are out there already, but I think it's something that's needed. Catherine, I want to thank you once again for joining us today. It's been very interesting to learn more about ImmunizeCA, and you've provided some really helpful advice to entrepreneurs out there who are looking at developing a solution in the health space.
I think I have one thing I might want to share with other people if they're thinking about doing health apps, because it's something I've been hearing a lot from other groups. I think there's a tendency, and maybe, you know, as a millennial, I've come into this a little bit naive, but there's a tendency to want to do a lot of back work, do a lot of focus groups, try and figure out, you know, what should your app look like. And then by the time you're releasing it, it's 2 years later, and maybe the platform you've wanted to build it on hardly exists anymore. One of the things that's been amazing for us and has really been a driver in not only our user adoption, but in expanding our research and our success in this, is you just have to release it. And there are going to be problems, and there are going to be bugs, and it's going to be terrifying. It's going to be Friday night, and your phone's going to go off, and there's going to be bug reports, and you're going to be on the phone with your developers. But there's no other way to do it. You just have to get it out. You have to give your users ways to communicate with you, respond to them, fix it. It's going to be a constant reiteration, but I think that's the way to improve it. Get it out and put out 10 updates in the first 2 months. But I think you just have to really put it out there. That's my advice.
Good advice, excellent advice. So I think with that, I think we'll close the discussion today. Hopefully we can have you back to continue the dialogue. It's certainly been very interesting. So this is Dave Farnes with John Reed for CATA. Signing off, we've been in conversation with Catherine Atkinson talking about a wonderful new app called ImmunizeCA. Thanks for watching. Bye-bye.